Per capita, we have more doctors of pharmacy in this country than any Caribbean country.
From your experience as chief pharmacist, and you mentioned this now, across the public hospitals, where does pharmacies have the greatest untapped impact in our healthcare system? Because people only look at doctors as having an impact. They don't think the pharmacists have an impact. So where does it?
So I think there's two answers here. We need to expand the role of pharmacists in clinical practice. Per capita, we have more doctors of pharmacy in this country than any Caribbean country. We have doctors of pharmacy in this Bahamas who are in private sector working in community pharmacy.
Okay.
We have doctors of pharmacy in Bahamians all across the U.S. who would love to come home, right? But here's the thing. You can't pay them $60,000 when they're walking out of school with a $220,000 debt. That makes sense. You got to pay them what they're worth, because every study that has been done across continents tells us that when pharmacists are involved in clinical care, when they're on those wards doing rounds with the doctors, when they're being able to be used as information centers, that medication errors are decreased, that the patient outcomes are much better, and that savings to the healthcare system, okay, rack up into the 7 figures. We have to get our pharmacists, our qualified clinical pharmacists, out of the pharmacy and onto the wards, working with the doctors and nurses as a complete healthcare team.